Okay, hi everyone. Let me see if, Sarita, can you hear me?
Yes.
Okay, good, because we started out the last one with some audio trouble, so it looks like they've been resolved. I just want to welcome you all here to our August 26th briefing. And let me start off with the CZU Lightning Complex fire. And just say what a tremendous job. Supervisor Horsley had an opportunity to go down to the EOC down in Santa Cruz, to the base camp. What a great job they're doing down there, and just the organization, the information flow. I just can't say enough good things about CAL FIRE and the leadership that they have taken on this and the way that they're communicating daily with the EOC here, and the tremendous work our EOC is doing with care and shelter. And certainly care and shelter of the animals also that are associated with many of these people that are being evacuated. So by the numbers, the cumulative numbers from 8/18 to 20 to 8/25, 2,359 guests have been screened. Total number of people served are 1,208. Total numbers of room assigned of people evacuated, and these are in hotels, various hotels around in San Mateo County, are 345 hotel rooms for a total of 761 people that are now housed in hotels. I can tell you, I haven't gone out to some of the hotels and saying thank you to Red Cross, and the Red Cross has done a tremendous job on this also. What great partners they have been through this crisis. People, feel that they are getting everything that they need, and just some heartwarming stories and some, tragic stories also about property loss. So it's one of those situations that we're glad to have these partners and all they do, and certainly our Human Services Agency working with folks on the care and shelter side of things is very important. So the latest wildfire information related to county and road closure maps you can see at smcgov.org/smc wildfire response. I can tell you that I would go to CAL FIRE, but we did get a briefing today, and we're encouraged by all the work that they're doing to contain the fire. I believe it was 19% contained at our briefing at 10:30 this morning, and in some critical areas also it was contained. But they're out there working night and day and just doing a wonderful job. And we're heartened certainly by the weather that we have had recently, and the ability to get more planes in the air and helicopters and really battle this from the sky. So in some of these very, very dense wooded areas. So just want to give you an update on that and just say that, we're certainly very proud of CAL FIRE and the relationship we have with them. And they are the county fire department. So looking at the dashboard, as far as COVID-19, you can see that we are at 7,849 cases. That's plus 61 Tuesday. Monday we had plus 117, Sunday plus 57. And I am sorry to report we've had 2 more deaths. Now we're at 130 deaths related to COVID-19. And just a reminder that the deaths are only reported twice a week. You can see the age group where this continues to grow, and the nice thing that Missy just brought up was that the confirmed cases are down into the 40s that we have here at 46, which is one of the lowest we've had in a while. But then you look over and we have 0 out of county. That is something that we have not had in a while. The surge beds, the ICU beds are all doing well. That is something that, we really hope that the governor will take a look at later as they look at the metrics. And he has indicated that he will come out with an announcement on Friday. It's our hope that he is looking at the metrics, and we'll see that in San Mateo County, we're doing everything right. And our numbers have not moved one way or the other dramatically for weeks now. And we feel that we've got the surge beds and ICU and other beds that certainly could handle an increased number of cases, though we are hoping that people are getting the message, and we think they are, that masks are important, that masks make a difference, and that you go everywhere now and you see mostly people are getting that message. So it's really the continued social events that people attend, especially at a younger age, that we feel that is probably driving some of these numbers, but we're within the range of that 100 per day, just slightly over that, and we're hoping that those metrics will change and we'll get off the watch list, and that there then will be a path forward to reopening some of these businesses that have been closed. So we will watch and wait for Friday on that announcement, and we're hoping that all of the advocacy on the part of health, on the part of our health officer, will pay off here, and that they'll take a new, fresh look and realize that we're doing pretty fairly well in this county as far as new cases. We are on, as we mentioned before, the monitoring list with 34 other counties, and 9 other counties have been taken off the list, including Santa Cruz, San Diego, and Orange County as of late. That doesn't, indicate that there's a path forward for these businesses to open that have been closed. It's just that they're off the list. In regard to Verily, some good news there. So far, 33,000, almost 34,000 people have been tested by Verily as of Monday, August 24th. Last week, 2,620 were tested. It looks like the Verily lab site went live on August 24th, and it looks also like their numbers as far as the turnaround time of testing have come way down, into that 2 to 4 day range. So they've really started to catch up with the use of other labs that have come online. So that is great news, because that is the information that we need to get back to our contact tracers so they can do their job and try to prevent the spread by having people isolate who were in contact with someone who was in fact positive. So we hope to get that down. And anecdotally, I've heard in some cases that it's down to 1 day turnaround. But having said that, they're only going to continue to do so many per day per the state, and anyone who has symptoms really needs to take advantage of their own insurance. Who has insurance should take advantage of their own insurance, which is free, and get tested. So I would highly encourage those with insurance, again, to go out and use their own providers to get tested. Just a little bit on the health numbers. In Redwood City, we've got 11 guests in our kind of step-down facilities. In the Bayfront, we've got Bayfront Station, we've got 84 guests with 74 rooms occupied. Total number of hotel rooms assigned to the homeless are 163 rooms at different hotels, with a total of homeless served at 181. So that is down just slightly. A little bit about the San Mateo County Immigrant Relief Fund. The Mission Asset Fund continues to provide $1,000 grants to qualifying immigrant families in need. And as of August 24th, they received 28,741 applications. That is just staggering, absolutely staggering. But 8,550 grants have in fact been awarded. And it should be noted that most, if not all, the families who apply for assistance do in fact qualify for help. So simply, there's not enough money. We need more money in that fund. There's people out there who are really hurting and who need these funds to survive on. And we're hoping that others will contribute to these funds. The priority has been given to households with a little to no income and those with kids. And 2 weeks ago, Mission Asset Fund staff began asking applicants if they or someone in their home had been diagnosed with COVID-19, and about 1 in 3 applicants responded that they did in fact have a member of their immediate family in the house who has now has COVID-19 or who had previously been diagnosed with COVID-19. So about 87% of the funds have been available, have been distributed. And as you can see, there's certainly not enough to go around. So we're hoping that those funds will come in from generous donors, and we will update you on that. That is really all I have today as far as updates, and I'd love to hear if you have any questions. We've got our trusty attorney, David Silverman, on the line. We've got Sarija here if you have any health questions. So let's see, Ms. Steve, if there's any. I have no asked questions here, so let's see if there's anyone.
We do have a question from Sierra. What is the county doing to help evacuees connect to support services and financial resources is her first question. And then she does have a second one.
Yeah, so through the Human Services Agency and the Red Cross, that information is available for evacuees. And I believe that they first get it at the evacuation center, and then we'll get follow-up at the hotels with the staff at the hotels. So we're still trying to find a clear path forward on the FEMA side of things. On the other things, on the other services, those are a little bit more straightforward, and we're getting that information into folks' hands.
And Sierra's second question is, how concerning is the RF rate increase, and are there any theories behind its increase?
Sarija, what do you think?
Sorry, when you say RF, do you mean the R effective?
Yes, that's on the website.
Right. So we update that weekly, and we, I think as Dr. Morrow's most recent statements have relayed, we expect as activity increases, it's challenging to keep that under 1. When we were in the shelter in place with very few activities occurring, we did see weeks with it under 1. Dr. Morrow continues to describe our current situation as stable. We need to keep reinforcing the key behaviors. We urge everyone to continue the great job with wearing the facial coverings, maintaining the physical distancing, and especially avoiding gatherings. That has been a source of spread in our community, but we continue to see the current situation as stable.
Great. Other questions?
Yes, from Sierra as well. Has there been any consideration of the governor's announcement today for increasing testing? And then I believe her second question, she may need to clarify, is what is the preparation for the county for the increase?
Well, I mean, I'll just take my shot, and then Sarija can certainly follow up. I mean, I think increased testing is great if that does come to fruition. But I mean, I think we're more interested, at least I'm more interested in more targeted testing in areas that we know that that we have hotspots as they come up. We need the flexibility to go into those areas and test and get ahead of those infections, whether it's an apartment complex, a neighborhood, a business, whatever it may be. But I think that is where we get the most value. But Sarija, your thoughts?
I did not hear what the governor relayed specifically today, but just would augment what Mike said by saying we really see the importance of testing to support the core public health mitigation, so that we can do case and contact investigation early and effectively. We also know that our healthcare providers still are contending with shortages and supply chain issues. So as we encourage residents to seek testing from their provider, we hope that the barriers that they're experiencing can be removed, and that takes actions at all levels.
Great.
Great. I see Henrietta has a question in the chat, but she also has her hand raised. So Henrietta, if you'd like to unmute yourself and ask your questions.
Henrietta, how are you?
Thank you. How are you?
Good, thank you.
That's good. I was wondering about the ongoing testing that will be held in East Palo Alto. Do you have testing dates beyond August? And would these dates be consistent for each month going forward?
Yeah, I mean, I do have them through just the early part of September. It looks like I'll give you Wednesday, the 26th is in San Bruno. Then Thursday in North Fair Oaks, Friday in North Fair Oaks. On Monday, August 31st, it's in San Mateo. The 1st is Half Moon Bay. The second is San Bruno, and then the third and fourth are in North Fair Oaks. So that's as far out as we've calendared so far because of the logistic needs that we have to put together. But you know, we are looking at the possibility and continued efforts like we did about a week ago of going in, the county going in and doing our own testing for certain segments where we feel that there's a need. And we do have the ability to do that. I'd like to see more support in that, right, from the state, but we do have the ability to do that. So if something pops up in East Palo Alto, if we believe that there's a necessity there, we will go in and do some testing in collaboration and cooperation with the city.
But isn't East Palo Alto one of the highest areas when it comes to COVID outbreaks? And wouldn't it be important? I noticed I didn't hear any dates for East Palo Alto, but wouldn't they be on a priority list, the city?
I don't know, Sarija, maybe you can talk about the aspects of where they are, but I can see on August 20th and 21st, we were in East Palo Alto. So that's Thursday and Friday. So we're doing it on a rotational basis, and I'm sure that we'll come back around to East Palo Alto.
Yeah, and Henrietta, what I would say is while we have the map of cases by city, we still believe that the under testing and need to stick, follow what the case data are telling us is the most important. And that did lead us to have the increased presence in East Palo Alto last week, and we would continue to do that. Anytime we're seeing a concerning cluster, we would want to jump on that quickly. The schedule, gets worked out in advance for all the logistical reasons that our teams are working on. I appreciate partnering with the city.
Okay,
Great.
thank you.
You have a follow-up question, Henrietta?
No, that was it. Why there wouldn't be any scheduled dates going forward for September?
Oh, I'm sure there will be in September. We just haven't worked the schedule up past September 4th, and it does take, cooperation of city assets and folks. So we certainly will work on that.
Thank you.
Anything else?
We have a question from Sarah Wright. Is there a reason the Half Moon Bay site was moved?
I don't know. Do you know, Sarija or Michelle?
Sarija can correct me. I believe, and I'd have to double check, I believe it was just because we couldn't use that site anymore. I believe it was the school, correct?
Oh, yeah.
I believe that's what it was. I mean, that's where we see some of the sites being changed. Even Henrietta, with some of our other North Fair Oaks. If you go to the testing page off of the county's main web page, you'll see all the different locations, and you'll see that there is a new location located in the Stanford parking lot, and that also was moved there for the logistical reasons of the prior site not being able to continue to be utilized.
Yeah, that's correct, Michelle. That we were utilizing some schools, and then when we thought schools would be open, we made plans to move them out of there. So, and hopefully at some point schools will be open again. So we want to make sure that we have a more solid point to operate out of.
And at this time, there are no raised hands and no other questions in the chat.
Very good. Thank you all for participating. We'll be back next Wednesday. Until then, stay safe, stay healthy, and take care of yourselves.